Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, hair problems was associated with middle age when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided and can be fixed by managing to modify our healthy lifestyle. Today, we have with us Dr. Grishma Habib. She is MBBS, MD in Dermatology, and she has been practicing for medicine over many years now and is known for her exceptional medical expertise. She is currently Chief Dermatologist and founder of Dr. Grishma Skin and Aesthetic Center, Hubli, which houses all the latest devices and treatment technology which are FDA approved. Dr. Grishma Habib has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized healthcare services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Grishma Habib is aware of the need for the patient awareness and education about hair care and has spent a lot of time in giving talks at various platforms across the country. Thank you, Dr. Grishma Habib, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you so much for having me on board. I'll be glad to answer all your questions.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So, Doctor, today we are going to discuss the hair care in current scenario. And when we talk about hair care, the first question which comes to our mind is the most common problem which are now facing by all of us, no matter of age, is hair loss. So, what's normal and when to be concerned for?
Hair is a very delicate protein structure, okay, and a little bit of hair we all lose in our day-to-day life. So losing about 50 to 100 strands per day is considered normal. So your point of concern comes if you are losing more than 100 strands per day. That is when you need to take a notice. Otherwise, gradual shedding of about 10, 20, 30 strands are quite normal because these are the dead hair that shed off so that the new hair begins to grow.
Okay. So, doctor, more than 100 to 20 is abnormal and we should visit the doctor. So, what are the general causes of hair loss? Can you little enlighten us on this?
There are hair loss is associated with various problems. The most common cause is nutritional deficiencies. And in an Indian scenario like ours, nutrition becomes a very common cause. One of the most common causes is iron deficiency. Okay, women don't eat well and end up having low hemoglobin, and their low hemoglobin has been there for a very prolonged period of time. Therefore, the hair fall. Apart from this, the other deficiency that we are seeing nowadays is vitamin D, B12 levels are low, and ferritin levels when evaluated are very low. That means to say that they have been deficient for a very long period of time and there are no iron stores in the body. Apart from that, there are endocrine disturbances like being hypothyroid, polycystic ovarian conditions. When you enter the phase of menopause, you have certain genetics. There's a family history of a patterned hair loss that is seen. Either the father has history of balding or mother has early loss or thinning of hair that is seen. Chemotherapy and certain other medications taken on long course of time can cause hair loss. Postpartum, especially 3 months after your childbirth, is a common cause of hair loss, but this is reversible. The hair tends to grow back within 6 to 12 months of age. Now, another common cause that we've been seeing is all the salon sessions that we've been doing, the various straightening, using of all the straighteners, various hair colors, and keratin, and all of these treatments are causing hair loss.
Okay. Very no to the chemical treatment. So, doctor, like you and you're like very informative that you have enlightened the causes. So, like another question is like, now like we are now the lifestyle of like we have a bad habit of sleeping late hours, working from home, not sleeping, not eating on time, and like you said that nutrition play a role. So can a person lifestyle also play a role in hair loss?
Yes, the lifestyle in today's environment, of course, because we are surrounded with pollution, we are surrounded with a lot of work stress. Now, stress is inevitable. Then we're, as you said, we're eating at wrong times, sleeping at wrong times. We don't get enough sleep. We don't eat well or skip meals. So all of this, apart from that, is smoking, and all the junk food that is available is causing a lot of effect or deleterious effect on the hair.
Okay. So doctor, now that we know the causes, the another question is like, what are the medical treatment options available for hair loss, like topical or surgical or non-surgical, or is there any oral also like we can eat and get the problem solved?
The treatment outline, the way we divided into something that is called topical. Topical is something that you apply, then something orally, as well as invasives. Usually we use combinations of treatment. It's never an isolated that, only something to apply or only something to eat. So on application, minoxidil has been there for a very long standing that we've been treating. Apart from that, the newer molecules that we've seen is Redensil, Procapil, then, caffeine is used, a little bit of arginine, a lot of peptides are used. So this comes in the topical line of treatment. In various percentage or combinations, these will be prescribed. Along with this, biotin has been, the vitamin of choice for hair loss. Apart from that, we currently prefer combination. That's something called the nutraceuticals, where, a lot of ingredients will be used, like biotin, rapeseed extract, saw palmetto, and your calcium. So these in various concentrations will be given orally. And if there is any obvious deficiencies, like as I stated, vitamin D or vitamin B12, these need to be rectified alongside the treatment. If you just take a hair care treatment while your underlying cause is unattended, there's no point. You won't see the benefit. Mm-hmm. Then apart from that, when all of this is not working or your response is slow, we have move on to invasives alongside these as an adjuvant. So we have derma rollers, we have PRP, which is platelet-rich plasma. The patient's own blood will be drawn. It is centrifuged, and there we derive growth cells. So we extract all of these and inject it back into the scalp. This happens in a couple of sessions. There are also threads that are available for small patchy hair loss that we see when we want to fill it up. The temporary, the transient is hair fibers that you are going up for a party and you just need to camouflage. Then there are hair fibers. The last, of course, is hair transplantation.
Okay, so wide varieties of treatment options are available.
Individualized. There is no standard protocol that every patient who walks in, this is what will be given to him or her. So based on what they have, what is the area of problem, how long has it been, and how well are they responding, a treatment protocol is charted.
Okay, so complete profiling need to be done to get the treatment. Okay. Okay. So like doctor, you said about nutraceutical and this word has been like getting a lot of focus nowadays. So what exactly is nutraceuticals and what is the role of nutraceuticals in our hair health?
Um, Something called the micronutrients that we say. These are certain nutrients that are required in small quantities by the body. And these could range from the vitamins like vitamin C, vitamin A, vitamin B12, vitamin K, then trace elements like zinc, selenium, copper, iron, and moving on to certain minerals like sodium, potassium, calcium, omega 3 fatty acids. All of these play a very vital role in the growth of a hair follicle. So when there is a deficiency or insufficiency of these will dramatically affect the hair growth and its structure. Therefore, supplementing these is important. Of late, we have seen that apart from the standard deficiencies, as I stated, vitamin D, B12, we see trace element deficiencies. This is due to the food that we eat, which is, has a lot of adulterated and treated with pesticides. So we are landing up in a lot of trace element deficiencies. Therefore, these need to be supplemented.
So these are the nutrients which is required for the good hair health. Okay. So like doctor, there is like there are a lot of there are like a lot of things in the market like so which are some of the herbal and plant extract or like phytoconstituent used in the management of hair loss like alopecia.
So these phytonutrients that you're talking is like the talk of the town in all the cosmetic formulations right now. We use them as a photoprotective agent or an antioxidant agent in various. So it's a multifunctional. So we have a lot of ingredients moving from like I'm talking about both herbal and the phytonutrients like caffeine, green tea extracts, your ascorbic acid, curcumin, which is an extract of from the turmeric, resveratrol. All of these have multifunctions. So photoprotective, anti-aging, as a nourishment, as an astringent effect. So we use them in formulations. These formulations could not only be something that you pop in as a pill, it could be fortified in your shampoos, in your conditioners, as well as in your hair masks.
Good information, doctor. So, doctor, like you said, nutraceuticals, and you also said about micronutrients. So, are they same, and what's the role of micronutrients in our hair health?
That's the thing. I said micronutrients are like these zinc and trace elements. So these have a definitive role. As I said, they need, these are elements that are needed for appropriate follicle regeneration. Now, see, the hair follicle is one of the cells that rapidly multiplies in the body. So, with high multiplication and replenishing rate, it needs to be well nourished. So, we need a little bit of everything. We don't need to, just pop ourselves with everything that is around. We need a little bit of everything for optimal function.
So, like instead of taking it we need to take it in an accurate amount. So,
Yeah.
like you said, the like take it in an appropriate amount. So the another question is like, is it required to take all these nutrients as per gender RD requirement, or we can just take it blindly? This is what another question comes up to the mind,
See, the
because there are so much Instagrams use this, use that.
media is flooding with a lot of information that we don't know what to pick up and what not to, because they show very believable results or talk very confident about their products. Now, RDA is recommended daily allowances. So let's split this up into two parts where, you pop in a vitamin, as you say, which is water soluble, like vitamin C and B complex. These are water soluble vitamins. So they will not be accumulated in the body. They will be eliminated in the form of urine. So therefore, you don't reach a toxic level, even if you just pop it up and, you're not monitored by somebody or a doctor or a physician. But if you take something which are fat soluble, like your vitamin D and vitamin E or vitamin K, these accumulate in the body fat stores. And when you continue to take in a high dose or an unrecommended dose, these can cause toxic levels and adverse effects will be led to. But having said that, these substances, when they are deficient, your clinician will start and monitor it at a high dose and then taper. But it's not for you to, prescribe yourself. So now the other point is nutraceuticals. These are okay to take it for a limited period of time. Sometimes when even it's not monitored.
Okay, so self prescription is like big no. It's better to consult.
In most of the scenarios, because you don't know where to stop, you don't know what to take. Are you taking the right ingredient or you're just pumping in? So from my point of view, is always have a guided and person and see what is appropriate for you.
Okay, so doctor, like when we are talking about hair loss, another common problem is the dandruff. So like, does dandruff cause hair fall?
Dandruff per se doesn't cause hair fall, but it's extremely itchy. It causes a lot of discomfort to the patient. So the patient tends to scratch, and scratching can lead to injury, infections, and these injury and infections in turn can damage or weaken the root and cause hair fall. But not directly. But yeah, 25% of hair fall is seen in presence of dandruff, but not a direct correlation. It's due to the associated problems the dandruff creates.
Okay. So dandruff do play a role in some way for a hair fall, and we should
some way, yeah. Okay. So it's controlled and maintained.
Okay. So, doctor, like we've been talking about dandruff, hair loss, so and you also enlighten us about the lifestyle. The stress is something which is not avoidable, like it is unavoidable for all of us. So, what's the impact of stress on hair health?
You've said most of everything, that it's inevitable to stay in an environment which is stress-free. How you manage your stress is important, but stress can affect your hair in 3 ways, like clinically. A patient can walk in with something we characterize as telogen effluent. It is one of the most common types of hair fall that we see in the OPD. It's a sudden shedding of hair that they see. This is, of course, reversible because there's no follicle damage that has occurred. Your body is in a state of extreme stress wherein the body tends to shed all the hair or pushes the hair from the growing phase to sudden shedding phase. The other way it can be affect is alopecia areata. Alopecia areata is a well-defined complete loss of hair, which is patchy. Like if you keep a coin on your hair and that area, that circumference of hair, there's complete absence of hair. It usually happens suddenly and a patient will discover it one fine day. It could be a single patch or multiple patches, not restricted only to the scalp. It can happen on any hairy part of your body. The exact cause is not known for why an alopecia areata happens, but definitely stress triggers it off. Most of them grow out of it and the hair completely comes back. But in severe cases like we say alopecia totalis, where the entire body hair is gone or lost. These are extreme cases, but alopecia areata can be triggered by stress. The third most common way is what we see in teens is trichotillomania, which is an impulse control disorder wherein, or we call it a hair pulling disorder. The patient constantly is pulling the hair out consciously or subconsciously from any accessible hairy side, like an eyebrow, eyelash, and a scalp. So when you examine the scalp, we see hair that is present in all length. It's not absence of hair, but you see broken strands, and each strand of hair is in a different length. This is done to get out of the negative emotions that they have, or they want to release the stress out. This is how in extreme scenarios stress can and hair fall will be presented to you.
Okay, doctor, very interesting that we also in stress we also tend to pull our hairs, and we actually don't know we are doing that.
Unknowingly we are playing with our hair and trying to pull, and then this snowballs itself, and then you tend to pull, and it's very gratifying. So you feel good about it, but to control that impulse becomes really difficult after a period of time.
So managing stress for healthy hair is really important. Okay, so doctor, it was very informative when you said stress do play a role in hair health, and now we are working from home, and we our mothers and our nanny and grandmothers, they always say ki for good hair put oil in your scalp and laga lo, अच्छे बाल हुएंगे, shine karenge. So the oiling is a boon or a ban?
We've all lived with this concept and grown with this concept, as you said, that you have to oil karo, and it will control your hair fall. And oiling is a solution to all problems of your hair, whether it's hair fall, graying of hair, or thin hair. But honestly speaking, from the scientific point of view, oiling has no role in controlling your hair fall or does not stimulate hair growth. The only way it can benefit you is it is an excellent hair conditioner. So it will cause nourishment of the hair and also act as a protective coating to the strands, because our strands are subjected to various environmental insults. So this is the only way the oiling can help. The other way is the gentle massage that you do during the oiling process. So it is this act that transiently increases the blood flow to the scalp. So when the blood flow increases, all the nutrients are going to be directed towards the root. But this is transiently, as long as you massage. The other thing that we've seen is people have hair oil all through the day or for days together until they shampoo their hair. But it's ideally not advised. We say that, keep it 2 to 3 hours prior to your shampooing and then wash it off, because oil can attract dirt and dust and also can increase your dandruff problems. Also, the excessive massaging, the act when you do, if it is done vigorously and not done appropriately, itself can weaken the roots and cause hair fall. Also, people with oily scalp and an outdoor person moving in a lot of dusty environment can land up into folliculitis and various scalp infections also. So it's not like a gold standard.
Okay.
Whether it is coconut oil, or almond oil, or onion oil is okay.
So for shining, you can apply oil and then wash it off.
Yeah. Yes.
Okay. So doctor, can you give us some important tips for healthy hair?
There are a lot of, first is how you manage your hair. Is the first step is do not use a very hot water shower on your hair. Hair is a delicate strand. It doesn't need that bubbling temperature of water to wash your hair. We all have bath every day. So we know how important it is to keep your body cleansed and dirt free. So scalp is also the part of your body, and that also needs to be washed regularly. Of course, based on what type of scalp you have. Those who have oily scalp, they need to wash it repeatedly. People who have a dry scalp, they can, wash it once or twice weekly. People with combination, twice is okay. So scalp hygiene, maintaining it is as important as you maintain your body hygiene or have bath. The second and the third is the choosing appropriate shampoos and conditioners. So the sulfate free and gentle shampoos which are not very harsh to be chosen, again based on the type of scalp and hair that you have. Those of you who have oily scalp and hair, choose a shampoo that is mentioned for oily hair, because we don't want more of moisture or moisturizing shampoos. But those on the dry hair will need more moisturizing shampoos. So people who have colored or bleached hair, they will need, sulfate free hair shampoos. And after every shampoo wash, conditioner is absolutely essential. Conditioner not to be touching your scalp, only the ends of your hair. Then do not wet comb your hair because they're very, very fragile and tend to break. Use a wide comb to detangle your hair, moving from upwards to downwards. We tend to use a lot of shampoo and we begin to wash from down upwards. But what we want is a lather to flow onto your lower parts of the hair. We don't need to focus a lot on washing on the lower parts of your hair. It's a scalp that is more concerned. Apart from that is a balanced diet, stay hydrated. If you're out in a very sunny environment, use a wide brim hat, because there are a lot of studies today that show that extreme ultraviolet exposure can cause premature graying. So that is another problem. When you're swimming or on a beach, always protect your hair with a cap. Salon sessions are absolutely no. Avoid them as much as possible. All the heating rod, curling devices, straightening. We've seen a lot of people who land up with frizzy hair, tend to go to the parlors, get a keratin or a cysteine done and say that, we wanted to manage our frizz. But the effect is going to be more damaging than what you started off. And we've seen that people who have a good volume and density, who've gone and done your straightening and all the salon sessions, really don't come back to their original density, no matter what. So a lot of damage is done by all of these heating devices.
Okay. Doctor, thank you so much. This discussion was very informative and I'm sure our viewers would be benefited by it. So doctor, can we take some questions from our live audience?
Surely.
Yes. So the first question from our live audience, very interesting question. Can a hair spa treatment help with hair damage and hair growth?
Not per se, but it is good in terms of conditioning. So I don't say that don't take a hair spa. Hair spa is okay, beneficial if you're looking in terms of conditioning, protective effects, not from the treatment point of view. You could start off with a treatment by your dermatologist and then continue along with it your hair spas. Even those who don't have a hair fall can take hair spas. There's no issues, but it's not treatment. It's more of pampering. The massaging that is done will, relieve you out of your stress. You're in a good mood. Your endorphins are high, and it is giving you a relaxing effect. So when you're relaxed, your body responds to it. So it's pampering, relaxing, conditioning. So you can go ahead and do it.
Okay, to manage stress, you can have a hair spa. Okay, so another question from our audience is, can a good shampoo really help to stop hair fall?
To some extent. To some extent. When you choose a right shampoo, it will definitely be beneficial. As I told, People who have oily hair, if you tend to use a very moisturizing shampoo, it's going to weigh down your hair. So you don't like the effect that, it becomes greasy much faster. Or somebody with dry hair, you use a drying shampoo, they are going to have frizz and, unmanageable hair.
Okay, so along with these good shampoos, we also need the treatment so that, the,
Yeah.
is it like, okay.
If it is a hair fall, you definitely need to be evaluated. If you're a person who just wants to maintain your hair and don't have any hair issues, you have to choose the right product. There's also a lot of media or focus on the sulfate free. Of course, sulfate free are beneficial. These are cleansers basically. So people who have an extremely oily scalp, we need cleansers in them. So the label that you read is sodium lauryl sulfate. So you just choose sodium laureth sulfate. So certain amount of sulfate is needed for people with extreme, greasy scalp. But those who are, have color treated hair, thin hair, frizzy hair, or dry hair, then definitely it has to be sulfate free.
Okay. Okay, very interesting, doctor. Another question from our audience is, ma'am, आपने oily scalp के लिए बताया, पर are dry scalp and dandruff the same thing?
Dry scalp and dandruff is definitely not the same thing. Each of us have a different skin type and hair type. So if you have oily skin, oily hair, dry skin, dry hair. So dry scalp is it's how you have been born with, unless you have been treated chemically or done a lot of hair styling sessions, which has you've landed up having a dry scalp. Dandruff, on the other hand, is completely different. Our skin has something called as a commensal fungi. So these fungi, they break and produce an acid, oleic acid. This is irritant to the skin, and that's when you have these flakes. So, and it produces a little bit of inflammation. So you have these symptoms of itching, discomfort, and it breaks the barrier. You land up in infection. So dandruff is completely different than dry scalp.
Okay. Okay, dry scalp and dandruff are totally two different things. Another question is very interesting. We all try to do. Are home remedies as effective as professional treatment for hair fall? या फिर home remedies से ही सब ठीक हो सकता है, doctor?
Definitely no. Definitely no. There is no equivalence to treatment by a doctor to your home remedies. These, as I said, you can take along with the other sessions, but not otherwise. You cannot call them as a treatment. And when you have hair problems, there's always an associated problem. So this has to be addressed.
Okay, so instead of just using home remedies, we should evaluate it.
Going to solve the problem.
Another question from our audience is, I have a dandruff problem since childhood. It does not stop still, and I see scalp getting dry, and I tried all possible anti-dandruff shampoo and home remedies too, but it keeps coming back. Do I need to visit doctor, or should I take some vitamin tablet?
The first thing, the question is all the various shampoos and treatment that she's taken, has it been prescribed or she just bought across the counter with all the social media that is there?
She popped it. Yeah, I did it by myself.
Yes. So you could have done or used wrong products, because there are certain anti-dandruff shampoos, yes, they do cause dryness. So if you've been vigorously using them without somebody telling you what to use, it is going to be not under control. So go see a dermatologist, get it examined, what exactly is the problem. See, dandruff looks very, very similar to something we called as seborrheic dermatitis. So this is a next step, seborrheic dermatitis is inflamed skin. They could look alike, so they need to be treated. Sometimes seborrheic dermatitis, we need a short course of steroid to control it. So control it, use an appropriate shampoo, get yourself examined what exactly is the problem, then just buying everything across the counter or what is popping on Instagram. You could, making your scalp dry and damage the root.
Like you said, stop self-prescriptions.
Yeah, self-prescribe.
Another interesting question, doctor, I would request you to please suggest me some supplement for hair growth and increase the volume, since my hair is thinning rapidly and there is a lot of hair fall and I'm just 25 years old.
There's no magic pill, but you have to have your labs done. If you're an indoor person, or if you're somebody who's doing work from home, or constantly indoors, get your vitamin D levels done. Supplement your vitamin D. We've seen vitamin D being very commonly deficient. I think out of 8, 5 would be deficient. So get your labs done. Then choose appropriate supplements. Just taking, we've seen a lot of biotin gummies that are coming on the media right now, but biotin alone cannot be beneficial. As I said, you take multiple ingredients or nutraceuticals which will have a lot of ingredients like grapeseed extracts and saw palmetto, biotin, your iron levels. As a female, our iron levels are very important and do play a role in the hair functioning. So I cannot prescribe just some tablet. You need to know your labs and use appropriate hair care products. Avoid styling. If you're a 20-year-old, I'm sure you'll be all into the styling sessions.
Yeah. It's very informative, doctor. Another question, I think all youngster who wants to know, please suggest some hair care tips for people who are active and work out every day. Do we have to wash our hair every day after exercise?
Yes, it is, because sweat will accumulate dirt will bring in infection, dirt will get you scratching will cause more infections, and sweat may clog your follicle and you may land up in hair folliculitis. So keep your scalp clean. At least rinse it off if you're not shampooing. Rinse with water.
Okay, so washing every day after exercise is okay.
Sometimes is okay. A lot of us think that we cannot wash our hair every day. As I said, it is hygiene. It's a hygiene practice based on what is your lifestyle and what kind of work you do, what kind of scalp you have. It is okay to wash it even if it comes to every day. But use a gentle cleanser.
Okay, very interesting. Okay, doctor. Another question, doctor, like you said that chemical treatment is not good, but I am very young and I have gray hair, so I color my hair. So will it damage my hair, and do quality of hair color matters because I do color at home?
Yes. See, graying has become one of the most problematic scenarios right now in youngsters. Is, of course, nutrition deficiency, genetics. Sometimes, if parents have early graying, they tend to gray even more faster as compared to the parents. So there are treatment options for graying hair, premature graying, we say. So if you are less than 30 years old, there are options to get yourself treated. Just otherwise, you'll end up just camouflaging it. And end of the day, all these hair colors do take a toll on your hair structure and health. So if you are in that less than 30 years old, make sure you have a balanced diet. Eat well. We say eat like a rainbow. So, you eat all these pigments, which are fruits which are brightly colored, vegetables that are colored, that could be red, pomegranate and, papayas and, your green teas, all of these. So you eat a balanced diet, that will definitely show on your hair. Also your protein. So eat protein rich food, because hair is basically protein. So you need a good protein intake. So as much as possible, try avoiding, but in case you cannot avoid, there are also medical hair dyes. These are, less toxic, they're less damaging. The chemical contents are not very high. They don't stay for a very long time. So you could switch on to medical hair dyes also, or hair colors.
Okay. Very interesting, doctor. Another question is, doctor, you said that heating and the chemical treatment damage the hair. I have already done, and I see lot of hair fall now. So can it be reversed?
It will not be reversed 100%. As I said, it will not be. So please restrict all these treatments. And repeatedly using a straightener or anything has led to a lot of graying of hair. So we can treat you. It's not that you're in a situation you cannot be treated, but you can be treated. But to get back 100% result is not possible. But you will definitely be better once you start treatment.
Better to stay away from such kind of treatment.
Rather than getting yourself.
Yeah. Another question is, doctor, I do fastings and for to lose weight, I am following crash diet. So, and after starting this diet, I see hair fall. Is it because of fasting?
Yes, crash diets have been one of the most common causes for telogen effluent. As I said, telogen effluent, where the body comes in a state of stress, and there's sudden shifting of all the hair that's growing into resting phase and shedding phase. So crash dieting will deplete all your nutrients. The body goes in a state of shock. You'll end up in telogen effluent. You have to weight in a more controlled and gradual way.
So you would recommend that instead of we can get a customized diet?
See a nutritionist, get a customized diet plan, what is advisable for you. You could do
So, doctor, because we are going out of the time, so I just quickly take two questions. One, doctor, my daughter is just 12 years old and she has a gray hair. So, should I take her to the doctor, or give him medicine? Can you help me?
do not self-prescribe, but improve the diet of the child. Make sure the child is eating well, the right ingredients, proteins, vitamin C rich diets, lot of nuts, and make sure the boy or girl, I don't know, but iron levels to be maintained, appropriate sun exposure. This is what she could do from home, and also get the child examined and treated.
Okay, so for these young age gray hair, treatments are there, they can be stopped.
These are long, they take a lot of time, because we are focusing on the root. Once the gray hair has come out, we are not trying to color the hair that's already grown out. We want the new root, the root to produce new pigmented hair, not a gray hair. So these take time, and nothing in hair happens in 15 days or 20 days. It takes.
Okay, so these gray hair is because of lack of some nutrients in younger teenagers.
It's always a multiple problem. As I said, genetics, nutrition, lifestyle, and heat devices.
Okay. Okay, I'll just quickly take this last question from the same person. Also, doctor, I'm 32 years old and my hair is all gone. And is it because of that my daughter have white hair? And like, will this problem will pass to her also? Is there any treatment for me also and for my daughter also?
My hair is all gone. I didn't understand. My hair is all gone, and my daughter has gray hair.
Yeah, so he might be thinking that, because his hair is gone, like he's bald, and he's worrying that even it will pass on to her daughter, and because he's seeing gray hair.
We cannot predict it
Okay.
unless, but as I said, all the lifestyle choices and all that could be gifted and advised to the child, but we cannot predict that every person who's had, or like every father or every mother who's had early balding, the child also should have it. Of course genetics are stronger, but we can't predict it for you. But
Okay.
if you have a receding hairline, like as a teenager, if you see that the hairline is receding, or the crown, the top of the hair that you see is becoming scanty, then yes, there could be a genetic contribution, and it's time that you approach a dermatologist and start treating and take an action. But as a child, I cannot predict if your child is going to have hair issues like you. But if there is, as I said, early graying also, it runs in the family, but cannot, like if there are three siblings, not all three are going to have gray hair. One may have, or all three may not have. They could go on the other parent as well.
Okay, so uh,
It cannot be predicted.
okay, so it is not like like other disorders like diabetes or something. It just passed to family.
Even diabetes, we don't know. No, not every child. Like if I'm diabetic, it's not that all my children are going to be diabetic. You are always at a risk of it.
Okay. Mm-hmm.
But you are at a risk of it, but nobody can tell you for sure you are going to become diabetic. You are going to have balding, or you are going to have premature gray. You are at a risk of it. So,
Okay. Okay, doctor. So, uh, doctor, finally, doctor, would you like to give us a take-home messages or any suggestion to our viewers today?
I've spoken so much. I think one important is hair does make your statement, and hair is what is shown the most. It makes up your personality. So take care of it. Don't use excess products. Try to be as restricted as possible, and eat well and stay hydrated.
Okay, doctor. So eat well, stay hydrated, and no to chemical treatment and self-prescription, as you said. Okay, thank you so much, doctor, for sharing so much of information and all your expertise with us today and answering all the questions of our viewers. I'm sure our viewers have found this session very helpful. Thank you, doctor. It was delight to have you, and thank you so much for your valuable time.
Thank you so much for having me.
Thank you so much, doctor. Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma, your host, signing off for today.